It's time now for Countywide, a special presentation of Yavapai Broadcasting News. Join News Director Paul David and News Editor Philip Catafamo as they talk with our community's leaders, newsmakers, and people in the know. You'll hear about the hot topics in Yavapai County that affect all our lives. And now here's today's Countywide.
Ladies and gentlemen, welcome to Countywide. I'm Paul David. As always, it is great to have you along with us. A little different Countywide today. We're going to be doing this over the phone. We have Yavapai County Community Health Services Director Leslie Horton on the phone. Welcome.
Thank you very much for having me.
And then Yavapai County Spokesman David McAtee also on the phone with us this morning. Thank you.
Hey, good morning, Paul.
We're directing everybody to yavapai.us. We can get information about the COVID-19 there. And then you can also, there was a phone number I noticed you guys on the latest update, Leslie, that you put on the website on the 17th of March. That was 1-844-542-8201. What does that number exactly go to? Is that for you guys, or is that just a worldwide number?
That is actually a statewide hotline that has just been employed. Poison Control actually rolled that one out to answer questions from the public on COVID-19, realizing that locally it's difficult to handle the volume of calls that would need to be answered. They have rolled out that hotline. It's very useful, and I recommend it.
Okay, beautiful. Okay, let's get started. How are we? Where are we at with COVID-19? Because things have dramatically changed in the past week.
Things do change on a daily and hourly basis for us and for our communities. And at this point, I can still say in Yavapai County, with the tests that have been done so far, there are 0 confirmed cases of COVID-19 in Yavapai County. However, across our state, the condition of COVID-19 and the spread of COVID-19 seems to be taking an increase. And so yesterday we had stated that there was 20 confirmed cases, and by today we have 27 confirmed cases across the state, which include 11 in Maricopa, 5 in Pima, 8 in Pinal, 1 in Graham, and now 2 in Navajo County. And so those cases in Navajo County that were confirmed yesterday were the first in northern Arizona that we knew of.
Okay, so obviously we're still seeing it spread.
Yes, it is spreading, and with this virus, as we've seen across the globe, it doesn't seem to slow down quickly. We can do our best to mitigate it from spreading fast here, and some of the measures that we've taken so far help to slow the spread of it, but we are still seeing the spread of the virus.
Now, I've heard that this virus also can sit in me for a couple of weeks before it even shows itself. Is that still the case?
Yes, the virus is shown to sit dormant sometimes between exposure of someone coming into exposure with someone else who had it from 2 to 14 days. And so that kind of incubation period is difficult for us as public health officials to be able to track sometimes, because with a lot of illnesses, right when you're exposed to them, you come down with symptoms within a few days. And it lessens the spread of those viruses, kind of like the flu, which still spreads rather rapidly. This one, with a 14-day period, we've seen that you can be contagious within that period of time, the first 14 days, even before you show symptoms. However, you become most contagious when you start showing symptoms, as you start coughing, sneezing, having that fever, and you just become far more contagious. So we do still have some concern, though, that if people are not showing symptoms and they are going about their daily lives, they could be spreading the virus if they were otherwise exposed prior.
That kind of rolls us right into the next thing, the social distancing, something we've been talking about in the news for, I want to say, the last month and a half now with Stephen Everett, is that social distancing is what we've been really asking people to do, and now it's kind of being forced on the public.
I'm going to let David answer to this one.
It's not that we're coming out and saying by law you have to stay home. It's just we're asking people to be wise, make good decisions, and one way to really stop this spread is not being mere people. And so if you can avoid those groups, and we're saying anything over 10, not that that's a magic number, but that's just kind of a criteria that came down from the federal government, the state government. And so avoid crowds of anything more than 10 people. If you're going to be out, and I know a lot of restaurants are already closing their dining rooms and only allowing drive-through or takeout situations, do that if you can. But just, be smart about this. If you can't sneeze on somebody, then you can't get somebody sick. And so just, take some general precautions. Try to avoid those large groups, anything over 10 people. And, again, if you are sick, stay home. Don't try to be tough. Don't try to tough it out. Even if you don't know that it's coronavirus, you're sick, stay home. And we tell that to anybody throughout the year, and this is just really important right now. Because of the elderly that are so affected by this, it's incredibly important to take action and be responsible for your own actions.
Why did we pick, the schools are all closed in the state until March 27th? And then I've noticed some closures are going as far as April 1st. I've noticed some are like 30 days from now, from mid-March until mid-April. Is there any reason why March 27th was kind of picked? Because I feel like maybe the public might get the idea of, on March 27th, this is going to be over with, and we can go right back to what we were doing before. But that may not be the case?
I think that the reason for that was for multiple reasons. And so one of those reasons is that 14-day period of time between exposure and becoming more contagious, and coming down with symptoms. And so the schools chose a 2-week time frame that would possibly help if people had traveled internationally or even within our nation for spring break, and then they're coming back to our area or to the state now that the governor has said all schools stay closed until March 27th. It gives those people a time period to see if they're sick or not, hoping that they'll kind of do their part in staying close to home during this 2-week period. The other reason, though, that I've heard many of the superintendents discuss is that it gives them time to think about and see the kind of how this situation evolves. It's changing daily, and that gives them some time to make those decisions based on if they need, based on what we're seeing, what other parts of the state and the nation are doing, and do we need to keep schools closed longer?
Right. Are the cases going to continue to go up over the next week, or are they going to start going the opposite direction? We're going to start maybe seeing a light at the end of the tunnel here.
Not in our area. I can probably safely say that we're seeing an increase right now, and like I said, still no cases in Yavapai County. But as we've seen in other parts of the country, even when they take some pretty extreme measures to confine and socially isolate people away from the virus, it's still spreading in many areas of our nation. And so in our state, just seeing these jumps in numbers on a regular basis now, going from 20 to 27 in the state yesterday, we are taking preventative and proactive measures across our county and across the state. However, I think that it's going to be a little while here before we start seeing any sort of decrease or stabilization even of the virus.
Okay, let's take our first break. Yavapai County Community Health Services Director Leslie Horton in studio with us today. Also, David McAtee, Yavapai County Spokesman. Website for you, yavapai.us. You can also go to the CDC website as well. Tons of information on there about the COVID-19. A phone number for you to jot down, 1-844-542-8201. I'll pass that number on several more times. Stick around, Countywide back in just a couple minutes.
Regrow, repair, replace. Regenerative medicine is the process of creating living, functional tissues to repair or replace tissue or organ function lost due to age, disease, damage, or congenital defects. Dr. Forrest Lanchbury and the team at Sedona Regenerative Medicine specialize in finding relief for patients suffering from chronic pain. Contact Sedona Regenerative Medicine to learn about anti-aging medicines that will help your body heal itself. 928-282-2520 or SedonaRegen.com.
Starting in the late 1920s, Grandpa Gettle and his brothers laid the groundwork for what would become a family legacy. Almost 100 years and 100 patents later, Gettle's High Desert Mechanical continues to raise the bar of quality heating, cooling, and plumbing products and services in the Verde Valley.
Call Gettle's High Desert Mechanical Heating, Air Conditioning, and Plumbing at 567-2200 or online at GettlesHDM.com, providing solutions for your comfort. Don't settle, get Gettles.
With too many senior homeowners falling short in their retirement dreams, there may be great news for you. A reverse mortgage may be the answer. The flexibility it provides may help you with your retirement dreams, peace of mind, and quality of life in your retirement. For your in-home, no-obligation consultation, contact me at 928-225-7418. That's 928-225-7418. Or you can find me at Facebook at Jim Hostler, Reverse Mortgage Specialist.
Hi, this is Lori and Melissa from Sedona Soul Spaces. We are the premier source for all your interior design, decorating, and staging needs.
Every day people ask, why didn't I call you sooner?
Let us use our passion, creativity, and experience to make your life easier.
Don't make costly mistakes. Call us and we will help save you time and money.
We offer full-service interior design, custom furnishings,
complete home staging, turnkey vacation home packages.
Sedona Soul Spaces, creating extraordinary spaces that delight your soul.
Welcome back to Countywide. I'm Paul David, Yavapai County Community Health Services Director Leslie Horton in studio with us today, as well as Yavapai County Spokesman David McAtee. Website again for you is yavapai.us. Phone number 1-844-542-8201. You can call that number and get information and questions about COVID-19, any that you may have. Let's jump back into the social distancing really quick. I've been hearing people, younger people, actually say, "Well, this is affecting the elderly, and it's affecting people with underlying health concerns, and it's not really affecting children or kids or young adults. And so, why do I have to abide by these restrictions that are being put in place across the world?"
Well, there's reasons for everyone thinking outside of their own current situation. And it is true that children and young adults are not impacted nearly as severely with health consequences from COVID-19. However, we do have age groups within and groups of people within our communities who are at very high risk of becoming very ill from this. Our elderly individuals and even someone who is over 60 who has other co-occurring conditions, such as lung conditions or other things that would compromise their immune system, they can be considered high risk for COVID-19 complications. And then as your age goes beyond that, like 75 to 80 plus, and especially with any co-occurring illnesses or a compromised immune system, the ramifications of COVID-19 are rather severe, and that's where we see that death rate come into play in terms of across the world. And yet, our youngsters may not even feel symptoms when they are exposed to this and come down with symptoms or stay asymptomatic, we call it. And they feel as though they can live regular lives and go around playing and convening and doing all the things that we are recommending they not do, especially when they're not at school right now. And the difficulty therein lies that if they're doing all of those things and then come into contact with one of our most fragile citizens who could come down with this and be very sick, that type of spread could quickly become detrimental to our community. And so we really do. That's where the social distancing comes in. I recommend, even though those kids are not in school right now, that the parents do their due diligence and really try to practice all of these social isolation and keeping the kids outside possibly, too, is good for them. Not necessarily keeping them outside, but encouraging them to play outside, but also to keep them away from those people who could be at high risk for complications with COVID-19. David, do you have anything to add to that?
I think, and I say this during flu season and fire season and season, if you have seniors that live near you, check on them. Just make sure they're doing okay. We're not asking you to go spend some time with them and spread the disease with them necessarily, but just knock on the door, make sure they're doing okay, and again, just be a good citizen and check on them. And again, if you are home, if you are sick, please stay home. You don't want to lose a parent or a grandparent because you wouldn't stay home when you were sick. So just again, like Leslie said, think outside your own personal needs and think of the community as a whole.
Let's talk about the community. How have they been through this, Yavapai County, in terms of calls and talking with you, Leslie, and the health department?
I have to say that I am so proud of our community and the way that we are embracing all of the changes coming our way and all of even the anxieties that come along with this unprecedented pandemic that we've watched it sweep across the globe, and now it's here on our home turf. And our community has just poured in support between all of the agencies, healthcare providers, first responders, people who can pitch in and help our seniors. There is support and people willing to stop what they're doing to consider the needs of others and to really come together as a community to help. And so I've seen the strength of our collaborations and the ability to work with each other and come together when it's needed. The other, thing that I see is that we do have still some shortcomings as well. We are addressing this. They're sometimes limited by resources at our disposal. And so just this week, we started receiving more test kits for our local labs to start doing testing for COVID-19. And that's been a huge improvement because I can sit here and say that we have no cases confirmed in Yavapai County, but that truly is with limited testing. And so, I appreciate how the community has come together, how everyone's working together towards this, common goal of trying to mitigate the spread and take care of each other. But we also need to get a better idea of the current situation here. And do we truly not have any cases, or do we have any lying dormant that we just don't know about yet?
This is going to be with us for a while, huh?
Yes, it is. And we're hoping that it's mild, but we're not assuming that it will be. And so we are preparing. We're communicating with, as I said, all the different agencies, the municipalities. We want to get the message out there that this can be beat with some basic hand washing and isolation. But again, we do believe that this will grow as we get more tests done, and we don't need to panic. This is not the time to panic. The time is to plan. We don't need to rush out and buy off all the groceries off the shelves. Just buy what you need. Be a little bit prepared, and don't panic.
We've talked about this so much, haven't we, over the years? You and me, David, Stephen, Health Department, emergency management, to be prepared. Yes, absolutely. And the messaging hasn't changed. You need to be prepared, be calm, stay alert and aware of what's going on, which I love the fact that you've given out Yavapai.us, and if you go to /CHS, Community Health Services, CHS, you'll get the up-to-the-minute information. If we do have a live case in Arizona, we'll let you know. Yeah, most definitely. Okay, let's take our second break, and then we'll come back, kind of wrap things up and point people in the right direction as to where they can get more information if they need to, okay? Yavapai County Community Health Services Director Leslie Horton in studio today. Also, Yavapai County Spokesman David McAtee. Yavapai.us is the website. The phone number that you want is 1-844-542-8201. We'll be back in just a couple minutes.
Solid Rock Fitness is a one-on-one fitness studio specializing in fitness over 50. I train older adults of all fitness levels, from athletes and avid sports participants to folks with chronic pain to those recovering from surgeries. You and I will focus on strength training to improve overall muscle tone, core conditioning, balance, agility, flexibility, and nutrition. Mastery of these components of fitness will help you live your life to the fullest with confidence and competence.
Paul Stanley here with Stanley Steel Structures. We offer shade structures that provide style, value, and performance. Our Equinox louvered roof opens and closes to give you the ultimate patio experience. We also offer Alumawood shade covers that looks like wood but lasts like steel and never needs painting or maintenance. Visit us at StanleySteelStructures.com. Contact us today and be covered tomorrow. Stanley Steel Structures. Let us add some space to your place.
The EPA says C&B Construction ranks in the top 1% nationally. C&B Construction invites you to see what energy efficiency and indoor air quality can be. We have won another Department of Energy Innovation Award, and C&B Construction is the only contractor in the country to win 6 consecutive EPA Indoor Air Plus awards. Experience our zero-energy, move-in ready homes at Crossroads at Mingus.
C&B Construction, locally respected, nationally recognized. Find out more at candbhomes.com.
This is Bruce Morrow, Transportation Manager for Cottonwood Area Transit. Remember, we cover the entire Verde Valley and Sedona. Cottonwood Area Transit has you covered wherever you want to ride in the Verde Valley, all day, every day. Take Cottonwood Area Transit through Clarkdale, Verde Village, and from 26 locations in Cottonwood. With Verde Links, it's a quick and easy trip to Sedona every day. Don't forget our connectors to Camp Verde. Visit cottonwoodaz.gov for Cottonwood Area Transit and take a seat. Let's go ride.
Welcome back to Countywide. We've got just a few minutes left in the program. Yavapai County Community Health Services Director Leslie Horton in studio. Also, Yavapai County Spokesman David McAtee. Again, that website is yavapai.us. The number is 1-844-542-8201 for information about COVID-19. Small businesses, that's a good one. They're being very impacted. Leslie brought this up when we were taking a break there, that small businesses are being affected dramatically by this.
They really are, because a lot of restaurants are not letting people in. They're only doing takeout or drive up, and that's going to definitely affect not only the owner of the restaurant, but all the employees that depend on this for their livelihood. And so we're just encouraging you, if you can, go and buy gift cards from the local restaurants, your local food providers, or buy the takeout, the drive up. Do whatever you can to support them in this time of need, because you don't want them to go under. And we just, as a community, want to support our small business owners.
Yeah, it's truly important that we look at, our local economy during this. Obviously, the government is making some changes at a national level and trying to assist us. But there's a lot that we can do on a community level to look out for each other, to understand that we're all in this boat together, but some people are impacted more than others, either whether it's through their physical health or economically. And so look outside of your own situation, I recommend, and we can all think about ourselves at times, but in times like this, it can actually ease the stress on us if we can actually put ourselves in other people's shoes and think about how can we leave enough groceries on the shelves for those who truly need them. Most of us have enough right now. And, how can we help our neighbors, help our friends, help our businesses and our restaurants to also be able to weather this situation?
If I'm not feeling well, in our last minute here, if I'm not feeling well, what should I do?
Stay home, please. We ask that individuals who are not feeling well stay home. They can call the hotline. Google has employed a screening tool online, and you can call your healthcare provider. The healthcare providers are learning as to where local testing is happening. But a lot of times when I get calls, people have symptoms that are not even COVID-19. Check your symptoms. If you think you've got them, call your doctor, but stay home, please.
All right. Very good. Very good. Well, thank you both very much for coming in and doing this for me today. I appreciate it very much.
Thanks, Paul.
Yavapai County Community Health Service Director Leslie Horton, Yavapai County Spokesman David McAtee. Again, that website is yavapai.us. The number again, 1-844-542-8201. That's been today's Countywide. Thank you so much for listening, and we'll talk to you again next time.